मेरी बेटी जब हॉस्टल शिफ्ट हुई तो उसकी लो एनर्जी उसके पढ़ाई और स्पोर्ट्स के बीच आने लगी। कॉलेज लाइफ में कितना कुछ करना पड़ता है, क्लासेस, स्पोर्ट्स, म्यूजिक, लेकिन उसकी लो एनर्जी उसके लिए प्रॉब्लम बनती जा रही थी। फिर एक दिन मुझे पता चला गुड मॉर्निंग के बारे में। इस न्यूट्रिशन मिक्स में है एसेंशियल मल्टीविटामिन्स फॉर न्यूट्रिशन एंड क्लिनिकली प्रूवन प्रोबायोटिक्स फॉर हेल्दी गट। इसको लेना है बड़ा ही आसान, बस वो अपने लंच और डिनर में इसको मिला लेती है। खाने का टेस्ट, कलर, स्मेल कुछ नहीं बदलता। इससे उसकी गट हेल्थ बहुत बेहतर है और उसकी एनर्जी लेवल्स काफ़ी इम्प्रूव हुए हैं। तो अब क्लासेस, स्पोर्ट्स, नो प्रॉब्लम। हज़ारों फैमिलीज़ की तरह मैं भरोसा करती हूँ गुड मॉर्निंग पे अपनी फैमिली की सेहत के लिए। खुद ट्राई कीजिए और फ़र्क देखिए।
मेरा बेटा वीर बहुत थका थका रहता था। मुझे लगता था कि वो बहुत लेजी है, पर फिर मैंने अपनी न्यूट्रिशनिस्ट फ्रेंड से पूछा तो पता चला इसका कारण है न्यूट्रिशन की कमी। उन्होंने सजेस्ट किया गुड मॉर्निंग, जिसमें है जरूरी मल्टीविटामिन जैसे विटामिन ए, बी, सी, डी, आयरन, जिंक, फाइबर, प्रोबायोटिक्स और बहुत कुछ। बस उसके खाने में मिक्स कर देती हूँ और खाने का टेस्ट जरा भी नहीं बदलता। सबसे अच्छी बात है कि ये क्लिनिकली प्रूवन है। इससे रेगुलरली लेने के बाद वीर की एनर्जी में बहुत इम्प्रूवमेंट देखा है। आप भी ट्राई करें और फर्क देखें।
50 के हुए नहीं कि सब कहने लगते हैं जरा संभल के। After 50, our bodies go through so many changes, जिसकी वजह से poor digestion, weak energy, low immunity को हम common है बोलकर टाल दें। But now no more, because I've been having Good Monk Healthy 50 Plus, जिसे रिकमेंड किया मेरी डॉक्टर फ्रेंड ने। ये एक सैशे टेक्स केयर ऑफ एवरीथिंग, गट हेल्थ एंड एवरीडे एनर्जी। बस अपने खाने में मिक्स कर देती हूँ। इससे खाने का टेस्ट बिल्कुल नहीं बदलता। इससे एक सैशे में है 15 एसेंशियल विटामिन्स एंड मिनरल्स, विटामिन ए, बी, सी, डी, ई, के, आयरन, जिंक एंड मच मोर, प्रोबायोटिक्स एंड फाइबर, अश्वगंधा एंड ब्राह्मी। आप मानोगे नहीं, इसका असर मुझे कुछ ही हफ्तों में पता लगने लगा। I felt more energetic and even my problem of constipation was better. आप भी मेरे जैसे हजारों लोगों की तरह गुड मॉर्निंग हेल्थी 50 प्लस लेके तो देखो।
मेरे 50 साल के पापा की एनर्जी और ओवरऑल हेल्थ में इस एक चीज से बहुत फर्क पड़ा है, गुड मॉर्निंग हेल्थी 50 प्लस। बस मैं उनके खाने में मिक्स कर देती हूँ और उनके खाने का टेस्ट जरा भी नहीं बदलता। इस एक सैशे से उन्हें मिलते हैं 15 जरूरी विटामिन और मिनरल्स जैसे विटामिन ए, बी, सी, डी, आयरन, जिंक, साथ ही फाइबर, अश्वगंधा और बहुत कुछ। उनकी थकान और कमजोर हड्डियों की प्रॉब्लम अब वो सब गायब। आप भी अपने पेरेंट्स को ये लाके दें।
मेरी बेटी जब हॉस्टल शिफ्ट हुई तो उसकी लो एनर्जी उसके पढ़ाई और स्पोर्ट्स के बीच आने लगी। कॉलेज लाइफ में कितना कुछ करना पड़ता है, क्लासेस, स्पोर्ट्स, म्यूजिक, लेकिन उसकी लो एनर्जी उसके लिए प्रॉब्लम बनती जा रही थी। फिर एक दिन मुझे पता चला गुड मॉर्निंग के बारे में। इस न्यूट्रिशन मिक्स में है एसेंशियल मल्टीविटामिन्स फॉर न्यूट्रिशन एंड क्लिनिकली प्रूवन प्रोबायोटिक्स फॉर हेल्दी गट। इसको लेना है बड़ा ही आसान, बस वो अपने लंच और डिनर में इसको मिला लेती है। खाने का टेस्ट, कलर, स्मेल कुछ नहीं बदलता। इससे उसकी गट हेल्थ बहुत बेहतर है और उसकी एनर्जी लेवल्स काफ़ी इम्प्रूव हुए हैं। तो अब क्लासेस, स्पोर्ट्स, नो प्रॉब्लम। हज़ारों फैमिलीज़ की तरह मैं भरोसा करती हूँ गुड मॉर्निंग पे अपनी फैमिली की सेहत के लिए। खुद ट्राई कीजिए और फ़र्क देखिए।
मेरा बेटा वीर बहुत थका थका रहता था। मुझे लगता था कि वो बहुत लेजी है, पर फिर मैंने अपनी न्यूट्रिशनिस्ट फ्रेंड से पूछा तो पता चला इसका कारण है न्यूट्रिशन की कमी। उन्होंने सजेस्ट किया गुड मॉर्निंग, जिसमें है जरूरी मल्टीविटामिन जैसे विटामिन ए, बी, सी, डी, आयरन, जिंक, फाइबर, प्रोबायोटिक्स और बहुत कुछ। बस उसके खाने में मिक्स कर देती हूँ और खाने का टेस्ट जरा भी नहीं बदलता। सबसे अच्छी बात है कि ये क्लिनिकली प्रूवन है। इससे रेगुलरली लेने के बाद वीर की एनर्जी में बहुत इम्प्रूवमेंट देखा है। आप भी ट्राई करें और फर्क देखें।
50 के हुए नहीं कि सब कहने लगते हैं जरा संभल के। After 50, our bodies go through so many changes, जिसकी वजह से poor digestion, weak energy, low immunity को हम common है बोलकर टाल दें। But now no more, because I've been having Good Monk Healthy 50 Plus, जिसे रिकमेंड किया मेरी डॉक्टर फ्रेंड ने। ये एक सैशे टेक्स केयर ऑफ एवरीथिंग, गट हेल्थ एंड एवरीडे एनर्जी। बस अपने खाने में मिक्स कर देती हूँ। इससे खाने का टेस्ट बिल्कुल नहीं बदलता। इससे एक सैशे में है 15 एसेंशियल विटामिन एंड मिनरल्स, विटामिन A, B, C, D, E, K, iron, zinc and much more. Probiotics and fiber, अश्वगंधा and ब्राह्मी। आप मानोगे नहीं, इसका असर मुझे कुछ ही हफ्तों में पता लगने लगा। I felt more energetic and even my problem of constipation was better. आप भी मेरे जैसे हजारों लोगों की तरह गुड मॉन्क हेल्थी 50+ लेके तो देखो।
मेरे 50 साल के पापा की एनर्जी और ओवरऑल हेल्थ में इस एक चीज से बहुत फर्क पड़ा है, गुड मंक हेल्थी 50+। बस मैं उनके खाने में मिक्स कर देती हूँ और उनके खाने का टेस्ट जरा भी नहीं बदलता। इस एक सैशे से उन्हें मिलते हैं 15 जरूरी विटामिन और मिनरल्स जैसे विटामिन A, B, C, D, आयरन, जिंक, साथ ही फाइबर, अश्वगंधा और बहुत कुछ। उनकी थकान और कमजोर हड्डियों की प्रॉब्लम अब वो सब गायब। आप भी अपने पेरेंट्स को ये लाके दें।
मेरी बेटी जब हॉस्टल शिफ्ट हुई तो उसकी लो एनर्जी उसके पढ़ाई और स्पोर्ट्स के बीच आने लगी। कॉलेज लाइफ में कितना कुछ करना पड़ता है, क्लासेस, स्पोर्ट्स, म्यूजिक, लेकिन उसकी लो एनर्जी उसके लिए प्रॉब्लम बनती जा रही थी। फिर एक दिन मुझे पता चला गुड मॉन्क के बारे में। इस न्यूट्रिशन मिक्स में है एसेंशियल मल्टीविटामिन्स फॉर न्यूट्रिशन एंड क्लिनिकली प्रूवन प्रोबायोटिक्स फॉर हेल्दी गट। इसको लेना है बड़ा ही आसान, बस वो अपने लंच और डिनर में इसको मिला लेती है। खाने का टेस्ट, कलर, स्मेल कुछ नहीं बदलता। इससे उसकी गट हेल्थ बहुत बेहतर है और उसकी एनर्जी लेवल्स काफ़ी इम्प्रूव हुए हैं। तो अब क्लासेस, स्पोर्ट्स, नो प्रॉब्लम। हज़ारों फैमिलीज़ की तरह मैं भरोसा करती हूँ गुड मॉन्क पे अपनी फैमिली की सेहत के लिए। खुद ट्राई कीजिए और फ़र्क देखिए।
मेरा बेटा वीर बहुत थका थका रहता था। मुझे लगता था कि वो बहुत लेजी है, पर फिर मैंने अपनी न्यूट्रिशनिस्ट फ्रेंड से पूछा तो पता चला इसका कारण है न्यूट्रिशन की कमी। उन्होंने सजेस्ट किया गुड मंक, जिसमें है जरूरी मल्टीविटामिन जैसे विटामिन A, B, C, D, आयरन, जिंक, फाइबर, प्रोबायोटिक्स और बहुत कुछ। बस उसके खाने में मिक्स कर देती हूँ और खाने का टेस्ट जरा भी नहीं बदलता। सबसे अच्छी बात है कि ये क्लिनिकली प्रूवन है। इससे रेगुलरली लेने के बाद वीर की एनर्जी में बहुत इम्प्रूवमेंट देखा है। आप भी ट्राई करें और फर्क देखें।
50 के हुए नहीं कि सब कहने लगते हैं जरा संभल के। After 50, our bodies go through so many changes, जिसकी वजह से poor digestion, weak energy, low immunity को हम common है बोलकर टाल देते। But now no more, because I've been having Good Monk Healthy 50+, जिसे रिकमेंड किया मेरी डॉक्टर फ्रेंड ने। ये एक सैशे टेक्स केयर ऑफ एवरीथिंग, गट हेल्थ एंड एवरीडे एनर्जी। बस अपने खाने में मिक्स कर देती हूँ, इससे खाने का टेस्ट बिल्कुल नहीं बदलता। इससे एक सैशे में है 15 एसेंशियल विटामिन एंड मिनरल्स, विटामिन A, B, C, D, E, K, iron, zinc and much more. Probiotics and fiber, अश्वगंधा and ब्राह्मी। आप मानोगे नहीं, इसका असर मुझे कुछ ही हफ्तों में पता लगने लगा। I felt more energetic and even my problem of constipation was better. आप भी मेरे जैसे हजारों लोगों की तरह गुड मॉन्क हेल्थी 50+ लेके तो देखो।
मेरे 50 साल के पापा की एनर्जी और ओवरऑल हेल्थ में इस एक चीज से बहुत फर्क पड़ा है, गुड मंक हेल्थी 50+। बस मैं उनके खाने में मिक्स कर देती हूँ और उनके खाने का टेस्ट जरा भी नहीं बदलता। इस एक सैशे से उन्हें मिलते हैं 15 जरूरी विटामिन और मिनरल्स जैसे विटामिन A, B, C, D, आयरन, जिंक, साथ ही फाइबर, अश्वगंधा और बहुत कुछ। उनकी थकान और कमजोर हड्डियों की प्रॉब्लम अब वो सब गायब। आप भी अपने पेरेंट्स को ये लाके दें।
मेरी बेटी जब हॉस्टल शिफ्ट हुई तो उसकी लो एनर्जी उसके पढ़ाई और स्पोर्ट्स के बीच आने लगी। कॉलेज लाइफ में कितना कुछ करना पड़ता है, क्लासेस, स्पोर्ट्स, म्यूजिक, लेकिन उसकी लो एनर्जी उसके लिए प्रॉब्लम बनती जा रही थी। फिर एक दिन मुझे पता चला गुड मॉन्क के बारे में। इस न्यूट्रिशन मिक्स में है एसेंशियल मल्टीविटामिन्स फॉर न्यूट्रिशन एंड क्लिनिकली प्रूवन प्रोबायोटिक्स फॉर हेल्दी गट। इसको लेना है बड़ा ही आसान, बस वो अपने लंच और डिनर में इसको मिला लेती है। खाने का टेस्ट, कलर, स्मेल कुछ नहीं बदलता। इससे उसकी गट हेल्थ बहुत बेहतर है और उसकी एनर्जी लेवल्स काफ़ी इम्प्रूव हुए हैं। तो अब क्लासेस, स्पोर्ट्स, नो प्रॉब्लम। हज़ारों फैमिलीज़ की तरह मैं भरोसा करती हूँ गुड मॉन्क पे अपनी फैमिली की सेहत के लिए। खुद ट्राई कीजिए और फ़र्क देखिए।
मेरा बेटा वीर बहुत थका थका रहता था। मुझे लगता था कि वो बहुत लेजी है, पर फिर मैंने अपनी न्यूट्रिशनिस्ट फ्रेंड से पूछा तो पता चला इसका कारण है न्यूट्रिशन की कमी। उन्होंने सजेस्ट किया गुड मंक, जिसमें है जरूरी मल्टीविटामिन जैसे विटामिन ए, बी, सी, डी, आयरन, जिंक, फाइबर, प्रोबायोटिक्स और बहुत कुछ। बस उसके खाने में मिक्स कर देती हूँ और खाने का टेस्ट जरा भी नहीं बदलता। सबसे अच्छी बात है कि ये क्लिनिकली प्रूवन है। इससे रेगुलरली लेने के बाद वीर की एनर्जी में बहुत इम्प्रूवमेंट देखा है। आप भी ट्राई करें और फर्क देखें।
50 के हुए नहीं कि सब कहने लगते हैं जरा संभल के। आफ्टर 50 our bodies go through so many changes, जिसकी वजह से poor digestion, weak energy, low immunity को हम कॉमन है बोलकर टाल दें। But now no more, because I've been having Good Monk Healthy 50+, जिसे रिकमेंड किया मेरी डॉक्टर फ्रेंड ने। ये एक सैशे टेक्स केयर ऑफ एवरीथिंग, गट हेल्थ एंड एवरीडे एनर्जी। बस अपने खाने में मिक्स कर देती हूँ, इससे खाने का टेस्ट बिल्कुल नहीं बदलता। इससे एक सैशे में है 15 एसेंशियल विटामिन एंड मिनरल्स, विटामिन ए, बी, सी, डी, ई, के, आयरन, जिंक एंड मच मोर, प्रोबायोटिक्स एंड फाइबर, अश्वगंधा एंड ब्राह्मी। आप मानोगे नहीं, इसका असर मुझे कुछ ही हफ्तों में पता लगने लगा। I felt more energetic and even my problem of constipation was better. आप भी मेरे जैसे हजारों लोगों की तरह गुड मॉन्क हेल्थी 50+ लेके तो देखो।
मेरे 50 साल के पापा की एनर्जी और ओवरऑल हेल्थ में इस एक चीज से बहुत फर्क पड़ा है, गुड मंक हेल्थी 50+। बस मैं उनके खाने में मिक्स कर देती हूँ और उनके खाने का टेस्ट जरा भी नहीं बदलता। इस एक सैशे से उन्हें मिलते हैं 15 जरूरी विटामिन और मिनरल्स जैसे विटामिन ए, बी, सी, डी, आयरन, जिंक, साथ ही फाइबर, अश्वगंधा और बहुत कुछ। उनकी थकान और कमजोर हड्डियों की प्रॉब्लम अब वो सब गायब। आप भी अपने पेरेंट्स को ये लाके दें।
मेरी बेटी जब हॉस्टल शिफ्ट हुई तो उसकी लो एनर्जी उसके पढ़ाई और स्पोर्ट्स के बीच आने लगी। कॉलेज लाइफ में कितना कुछ करना पड़ता है, क्लासेस, स्पोर्ट्स, म्यूजिक, लेकिन उसकी लो एनर्जी उसके लिए प्रॉब्लम बनती जा रही थी। फिर एक दिन मुझे पता चला गुड मॉन्क के बारे में। इस न्यूट्रिशन मिक्स में है एसेंशियल मल्टीविटामिन्स फॉर न्यूट्रिशन एंड क्लिनिकली प्रूवन प्रोबायोटिक्स फॉर हेल्दी गट। इसको लेना है बड़ा ही आसान, बस वो अपने लंच और डिनर में इसको मिला लेती है। खाने का टेस्ट, कलर, स्मेल कुछ नहीं बदलता। इससे उसकी गट हेल्थ बहुत बेहतर है और उसकी एनर्जी लेवल्स काफ़ी इम्प्रूव हुए हैं। तो अब क्लासेस, स्पोर्ट्स, नो प्रॉब्लम। हज़ारों फैमिलीज की तरह मैं भरोसा करती हूँ गुड मॉन्क पे अपनी फैमिली की सेहत के लिए। खुद ट्राई कीजिए और फ़र्क देखिए।
मेरा बेटा वीर बहुत थका थका रहता था। मुझे लगता था कि वो बहुत लेजी है, पर फिर मैंने अपनी न्यूट्रिशनिस्ट फ्रेंड से पूछा तो पता चला इसका कारण है न्यूट्रिशन की कमी। उन्होंने सजेस्ट किया गुड मंक, जिसमें है जरूरी मल्टीविटामिन जैसे विटामिन ए, बी, सी, डी, आयरन, जिंक, फाइबर, प्रोबायोटिक्स और बहुत कुछ। बस उसके खाने में मिक्स कर देती हूँ और खाने का टेस्ट जरा भी नहीं बदलता। सबसे अच्छी बात है कि ये क्लिनिकली प्रूवन है। इससे रेगुलरली लेने के बाद वीर की एनर्जी में बहुत इम्प्रूवमेंट देखा है। आप भी ट्राई करें और फर्क देखें।
50 के हुए नहीं कि सब कहने लगते हैं जरा संभल के। आफ्टर 50 our bodies go through so many changes, जिसकी वजह से poor digestion, weak energy, low immunity को हम कॉमन है बोलकर टाल दें। But now no more, because I've been having Good Monk Healthy 50+, जिसे रिकमेंड किया मेरी डॉक्टर फ्रेंड ने। ये एक सैशे टेक्स केयर ऑफ एवरीथिंग, गट हेल्थ एंड एवरीडे एनर्जी। बस अपने खाने में मिक्स कर देती हूँ, इससे खाने का टेस्ट बिल्कुल नहीं बदलता। इससे एक सैशे में है 15 एसेंशियल विटामिन एंड मिनरल्स, विटामिन ए, बी, सी, डी, ई, के, आयरन, जिंक एंड मच मोर, प्रोबायोटिक्स एंड फाइबर, अश्वगंधा एंड ब्राह्मी। आप मानोगे नहीं, इसका असर मुझे कुछ ही हफ्तों में पता लगने लगा। I felt more energetic and even my problem of constipation was better. आप भी मेरे जैसे हजारों लोगों की तरह गुड मॉन्क हेल्थी 50+ लेके तो देखो।
मेरे 50 साल के पापा की एनर्जी और ओवरऑल हेल्थ में इस एक चीज से बहुत फर्क पड़ा है, गुड मंक हेल्थी 50+। बस मैं उनके खाने में मिक्स कर देती हूँ और उनके खाने का टेस्ट जरा भी नहीं बदलता। इस एक सैशे से उन्हें मिलते हैं 15 जरूरी विटामिन और मिनरल्स जैसे विटामिन ए, बी, सी, डी, आयरन, जिंक, साथ ही फाइबर, अश्वगंधा और बहुत कुछ। उनकी थकान और कमजोर हड्डियों की प्रॉब्लम, अब वो सब गायब। आप भी अपने पेरेंट्स को ये लाके दें।
मेरी बेटी जब हॉस्टल शिफ्ट हुई तो उसकी लो एनर्जी उसके पढ़ाई और स्पोर्ट्स के बीच आने लगी। कॉलेज लाइफ में कितना कुछ करना पड़ता है, क्लासेस, स्पोर्ट्स, म्यूजिक, लेकिन उसकी लो एनर्जी उसके लिए प्रॉब्लम बनती जा रही थी। फिर एक दिन मुझे पता चला गुड मॉर्निंग के बारे में। इस न्यूट्रिशन मिक्स में है एसेंशियल मल्टीविटामिन्स फॉर न्यूट्रिशन एंड क्लिनिकली प्रूवन प्रोबायोटिक्स फॉर हेल्दी गट। इसको लेना है बड़ा ही आसान, बस वो अपने लंच और डिनर में इसको मिला लेती है। खाने का टेस्ट, कलर, स्मेल कुछ नहीं बदलता। इससे उसकी गट हेल्थ बहुत बेहतर है और उसकी एनर्जी लेवल्स काफ़ी इम्प्रूव हुए हैं। तो अब क्लासेस, स्पोर्ट्स, नो प्रॉब्लम। हज़ारों फैमिलीज़ की तरह मैं भरोसा करती हूँ गुड मॉर्निंग पे अपनी फैमिली की सेहत के लिए। खुद ट्राई कीजिए और फ़र्क देखिए।
मेरा बेटा वीर बहुत थका थका रहता था। मुझे लगता था कि वो बहुत लेजी है, पर फिर मैंने अपनी न्यूट्रिशनिस्ट फ्रेंड से पूछा तो पता चला इसका कारण है न्यूट्रिशन की कमी। उन्होंने सजेस्ट किया गुड मंक, जिसमें है जरूरी मल्टीविटामिन जैसे विटामिन ए, बी, सी, डी, आयरन, जिंक, फाइबर, प्रोबायोटिक्स और बहुत कुछ। बस उसके खाने में मिक्स कर देती हूँ और खाने का टेस्ट जरा भी नहीं बदलता। सबसे अच्छी बात है कि ये क्लिनिकली प्रूवन है। इससे रेगुलरली लेने के बाद वीर की एनर्जी में बहुत इम्प्रूवमेंट देखा है। आप भी ट्राई करें और फर्क देखें।
50 के हुए नहीं कि सब कहने लगते हैं जरा संभल के। आफ्टर 50 our bodies go through so many changes, जिसकी वजह से poor digestion, weak energy, low immunity को हम कॉमन है बोलकर टाल दें। But now no more, because I've been having Good Monk Healthy 50+, जिसे रिकमेंड किया मेरी डॉक्टर फ्रेंड ने। ये एक सैशे टेक्स केयर ऑफ एवरीथिंग, गट हेल्थ एंड एवरीडे एनर्जी। बस अपने खाने में मिक्स कर देती हूँ, इससे खाने का टेस्ट बिल्कुल नहीं बदलता। इससे एक सैशे में है 15 एसेंशियल विटामिन एंड मिनरल्स, विटामिन ए, बी, सी, डी, ई, के, आयरन, जिंक एंड मच मोर, प्रोबायोटिक्स एंड फाइबर, अश्वगंधा एंड ब्राह्मी। आप मानोगे नहीं, इसका असर मुझे कुछ ही हफ्तों में पता लगने लगा। I felt more energetic and even my problem of constipation was better. आप भी मेरे जैसे हजारों लोगों की तरह गुड मॉर्निंग हेल्थी 50+ लेके तो देखो।
मेरे 50 साल के पापा की एनर्जी और ओवरऑल हेल्थ में इस एक चीज से बहुत फर्क पड़ा है, गुड मंक हेल्थी 50+। बस मैं उनके खाने में मिक्स कर देती हूँ और उनके खाने का टेस्ट जरा भी नहीं बदलता। इस एक सैशे से उन्हें मिलते हैं 15 जरूरी विटामिन और मिनरल्स जैसे विटामिन ए, बी, सी, डी, आयरन, जिंक, साथ ही फाइबर, अश्वगंधा और बहुत कुछ। उनकी थकान और कमजोर हड्डियों की प्रॉब्लम, अब वो सब गायब। आप भी अपने पेरेंट्स को ये लाके दें।
मेरी बेटी जब हॉस्टल शिफ्ट हुई तो उसकी लो एनर्जी उसके पढ़ाई और स्पोर्ट्स के बीच आने लगी। कॉलेज लाइफ में कितना कुछ करना पड़ता है, क्लासेस, स्पोर्ट्स, म्यूजिक, लेकिन उसकी लो एनर्जी उसके लिए प्रॉब्लम बनती जा रही थी। फिर एक दिन मुझे पता चला गुड मॉर्निंग के बारे में। इस न्यूट्रिशन मिक्स में है एसेंशियल मल्टीविटामिन्स फॉर न्यूट्रिशन एंड क्लिनिकली प्रूवन प्रोबायोटिक्स फॉर हेल्दी गट। इसको लेना है बड़ा ही आसान, बस वो अपने लंच और डिनर में इसको मिला लेती है। खाने का टेस्ट, कलर, स्मेल कुछ नहीं बदलता। इससे उसकी गट हेल्थ बहुत बेहतर है और उसकी एनर्जी लेवल्स काफ़ी इम्प्रूव हुए हैं। तो अब क्लासेस, स्पोर्ट्स, नो प्रॉब्लम। हज़ारों फैमिलीज़ की तरह मैं भरोसा करती हूँ गुड मॉर्निंग पे अपनी फैमिली की सेहत के लिए। खुद ट्राई कीजिए और फ़र्क देखिए।
मेरा बेटा वीर बहुत थका थका रहता था। मुझे लगता था कि वो बहुत लेजी है, पर फिर मैंने अपनी न्यूट्रिशनिस्ट फ्रेंड से पूछा तो पता चला इसका कारण है न्यूट्रिशन की कमी। उन्होंने सजेस्ट किया गुड मंक, जिसमें है जरूरी मल्टीविटामिन जैसे विटामिन ए, बी, सी, डी, आयरन, जिंक, फाइबर, प्रोबायोटिक्स और बहुत कुछ। बस उसके खाने में मिक्स कर देती हूँ और खाने का टेस्ट जरा भी नहीं बदलता। सबसे अच्छी बात है कि ये क्लिनिकली प्रूवन है। इससे रेगुलरली लेने के बाद वीर की एनर्जी में बहुत इम्प्रूवमेंट देखा है। आप भी ट्राई करें और फर्क देखें।
50 के हुए नहीं कि सब कहने लगते हैं जरा संभल के। After 50 our bodies go through so many changes, जिसकी वजह से poor digestion, weak energy, low immunity को हम कॉमन है बोलकर टाल दें। But now no more, because I've been having Good Monk Healthy 50 Plus, जिसे रिकमेंड किया मेरी डॉक्टर फ्रेंड ने। ये एक सैशे टेक्स केयर ऑफ एवरीथिंग, गट हेल्थ एंड एवरीडे एनर्जी। बस अपने खाने में मिक्स कर देती हूँ, इससे खाने का टेस्ट बिल्कुल नहीं बदलता। इससे एक सैशे में है 15 एसेंशियल विटामिन एंड मिनरल्स, विटामिन A, B, C, D, E, K, iron, zinc and much more, probiotics and fiber, अश्वगंधा and ब्राह्मी। आप मानोगे नहीं, इसका असर मुझे कुछ ही हफ्तों में पता लगने लगा। I felt more energetic and even my problem of constipation was better. आप भी मेरे जैसे हजारों लोगों की तरह गुड मॉन्क हेल्थी 50 प्लस लेके तो देखो।
मेरे 50 साल के पापा की एनर्जी और ओवरऑल हेल्थ में इस एक चीज से बहुत फर्क पड़ा है, गुड मंक हेल्थी 50 प्लस। बस मैं उनके खाने में मिक्स कर देती हूँ और उनके खाने का टेस्ट जरा भी नहीं बदलता। इस एक सैशे से उन्हें मिलते हैं 15 जरूरी विटामिन और मिनरल्स जैसे विटामिन A, B, C, D, आयरन, जिंक, साथ ही फाइबर, अश्वगंधा और बहुत कुछ। उनकी थकान और कमजोर हड्डियों की प्रॉब्लम अब वो सब गायब। आप भी अपने पेरेंट्स को ये लाके दें।
मेरी बेटी जब हॉस्टल शिफ्ट हुई तो उसकी लो एनर्जी उसके पढ़ाई और स्पोर्ट्स के बीच आने लगी। कॉलेज लाइफ में कितना कुछ करना।
थैंक यू। Sagar, the video is not stopped yet, the AV that was being played. Okay. Done. Sure, thank you. Okay. So let us start. Very good evening, everyone. I am Shreya Dhamani, nutritionist at Good Monk. Welcome, everyone, and nice to see you all who have joined. We have gathered here to hear from Dr. Seema Puri about a very important topic, frailty and nutrition implications in advancing age. Welcome also to the panelists who have joined us today. We have with us Mr. Amarpreet Singh Anand, who is the CEO and very good evening, everyone. I am Shreya Limited. He has over 21 years of experience as a marketing, sales, and innovation professional in consumer products. We have Dr. Sheila Krishnaswamy, ma'am, who's a renowned diet, nutrition, and wellness consultant with over 40 years of experience. She's also a part of Good Monk Scientific Council. We have with us Ms. Vinita Jaiswal, who's the convener of IDA MP chapter. She has over 20 plus years of working experience in clinical nutrition. She's also a former HOD of Dietetics, CHL Group of Hospitals, and Greater Kailash Hospital in Indore. She is former visiting nutrition faculty at DAVV University, a visiting nutrition consultant, and also presently owns a clinic at Indore. She's the founder of Nourish Me, the Nutrition Academy. She's a life member of IDA, IAPEN, and ASNFS. She has delivered talks in medical and clinical nutrition conferences and workshops all across India. She has also regularly published her articles in many leading newspapers and invited as a nutrition expert in many news channels, including Doordarshan, India News, IBC 24, etc. Thank you so much, Vinita ma'am and IDA MP chapter for collaborating with Good Monk for this nutrition summit. Would request you now to please welcome and introduce our esteemed speaker for the session, Dr. Seema Puri.
Thank you so much, Shreya, for my brief introduction. Good afternoon, everyone. Today, we have a very interesting session, and for that, we have one very senior and renowned person with us. I welcome Dr. Seema Puri, ma'am, and want to introduce her amongst all the participants. So, Dr. Seema Puri has over 35 years of teaching and research experience. She conferred the Nutrition Leadership Excellence Award by NIFTEM and Ministry of Food Processing in 2022 and the Rajamal P. Devdas Memorial Award 2020 by NSI for her outstanding contribution in applied nutrition. She has guided the research of over 50 MSc and PhD subjects, undertaken research projects funded by national and international agencies, and presented papers at numerous national and international conferences. She has over 110 publications in peer-reviewed journals and books to her credit. She is co-author of textbook on nutrition and dietetics and editor of book Children in India, Opportunities and Challenges. She is a member of several national and international committees, PRGs, scientific panels at FSSAI, ICMR, NDDB, etc. She is a member of several professional bodies, including SAI, FRN, NSI, and IDA. She was Vice President of IDA, India representative on Asian Federation of Dietetic Associations, and is now India representative on International Federation of Home Economics. So I welcome Dr. Seema Puri ma'am to take a session. Before that, I want to request to all the participants. Throughout this webinar, we encourage you to actively participate by asking questions and sharing your thoughts in the chat box. We shall have Q&A session in the end where your questions will be taken up. So I welcome Dr. Seema Puri ma'am to please take the session.
Thank you, Vinita. Thank you for a very gracious introduction. And it's lovely to be back with the IDA fraternity after a long, long time. I look forward to interacting with all of you. And I was just telling Vinita, I have pleasant memories of the IDA meeting in Bhopal. So as you all may know that my area of work has always been geriatric nutrition. And therefore, today I'm going to talk about a very important aspect of geriatric nutrition, which is frailty. And basically, nutrition, you know, is a driver of good health in old age. And therefore, looking at nutrition in Bhopal. So different nutritional aspects, you all may know that to prevent frailty in old age is very, very important. Now, what is frailty? Of course, is very important. But I would just like to state right at the beginning that, you know, unfortunately in our country, growing old is associated with frailty. So people take it as a normal process of growing old, that you can't walk properly, you are taking longer time to walk, you can't climb the stairs, and you know, this is a consequence of growing old. But that's not really true. And that is what frailty is, and this is preventable. It is controllable. Of course, there are many other factors besides nutrition, but nutrition plays a very predominant role in this. So, to give a background, what defines frailty is very, very important. And therefore, there are various definitions, but the common things are that it's a sign of poor overall health. It's a high vulnerability for adverse health outcomes. So whether it is falls, fractures, long-term care, dependency, disability, and then ultimately mortality also. It may involve multi-system dysfunction, and there is diminished strength, diminished reserve capacity, and inability to maintain a balance in the body. So we do know that frailty is a physiological condition, and there is a physiological decline due to aging and disease. But is it influenced by other factors like diseases, like psychological factors, social factors? All these are still being explored. Many of them we are able to conclude and know that they really are risk factors, but many of them are still being explored and studied. So it was first described in 1980, and that's why I said it's ongoing. It's an ongoing process of discovery. But one thing is very, very clear, that there is a consensus on the fact that frailty is not equivalent to disability. And similarly, cognitive frailty is not equivalent to dementia. So dementia is a disease. Alzheimer's disease is a disease condition. And cognitive frailty that comes with old age is not a result of that, or it's not equal to the disease. And frailty is a state of chronic inflammation. This has also been proved. And it has a progressive course unless we intervene. Is a disease condition. And the ultimate manifestation of frailty is loss of muscle mass, is also known as, or it's not equal to the disease. So obviously, frailty a state of chronic inflammation. This has also been proved. We know it's more common in older women than in men, and it's also seen more in lower socioeconomic states, groups. Maybe because nutrition is one of the factors. I already told you that frail people are at risk of falls, fractures, hospitalization, and other adverse health outcomes. And epidemiological research so far have identified some risk factors for frailty. One risk factor is chronic disease. So whether it is simple thing like obesity or CVD or diabetes, depression, cognitive impairment, all these are risk factors for frailty. Then, like I said, it's a state of inflammation. So inflammatory diseases, physiological impairments. So inflammation, atherosclerosis, autonomic dysfunction, hormonal abnormalities could also contribute to frailty. And then we have nutritional conditions. So it's also obesity, but it's also undernutrition. It's anemia. It's poor vitamin D status. Lack of many micronutrients could also contribute to frailty. And then, of course, it's also the social and the physical environment. So it could be the neighborhood characteristics, the life space. Is there a place to do exercise, to walk? Is there any social interaction between the elderly? Or they are living, very solitary lives? Are they living with their families, or they're in old age homes? All these also contribute to the condition of frailty. And as you can see here in this graph, that if the top line is normal aging and the bottom line is accelerated aging. So in normal aging, the period of frailty is very less towards the end of life, and it really doesn't cause any disability. But in accelerated aging, where we are not looking at the risk factors and we have not adopted a healthy lifestyle, frailty sets in much before disability. So, even on our studies that we have done in our institute, we found that above 50 years, we found a very high level of pre-frail individuals. So they haven't become disabled, or they're not really frail, but they have all the characteristics that it would lead to disability later on in life. Okay, so sorry, we've gone backward. Yeah. So now, how do we diagnose frailty? There are many ways of doing it. Many indexes have come in, many scales have come in. There are certain biomarkers that you can use, which include albumin, interleukin-6, CRP, and all. But a very simple way is this Fried's phenotype for frailty, which is that there is shrinking, exhaustion, strength, slowness, and low physical activity. These are 5 characteristics. So in the past year, if there has been unintentional weight loss, if there's lack of energy, there's tiredness, fatigue all the time, there's loss of strength, loss of physical robustness, skeletal muscle gets weak, and slowness. So you're taking much longer getting out of a chair, walking down, climbing the stairs, or an unsteady or an unbalanced gait. And of course, inactivity or a sedentary lifestyle. So if there are any of these characteristics, majority of these characteristics, then the person is frail. What is important is that the progression of frailty is a continuum. So you can transition from one state of frailty to another, and this has an impact on mortality. Unfortunately, it's more common to progress to a state of greater frailty than to move and improve to lesser frailty. But yes, with proper interventions, a person can become less frail. Okay, and that is why there is the potential that if we take care of nutrition, if we take care of activity, we can transition from, say, a frail state to a pre-frail state, or even better than that. So as you can see here, there is age-related physiological deterioration, various factors which we've just discussed take their toll on it, and it can lead to frailty. And frailty leads to functional decline. Now, if we do intervene, we can recover and go backwards. But generally, frailty is precedent to functional decline by some stressful event. And this functional decline can lead to disability. Again, if we intervene, it can lead to recovery and we go back to frailty. But if we don't intervene at this stage, the disability ultimately leads to hospitalization, institutionalization, or even mortality. So when we look at frailty and other syndromes, they're all interrelated. So we can't really segregate all of them. So there's frailty, which is, we've talked about. There's sarcopenia, which is progressive loss of skeletal muscle and strength, generally with adverse outcomes. This also is, there's cachexia, which is a metabolic syndrome where there is again illness and loss of muscle and fat. And all these are interrelated. And if you read the interesting, sentences or phrases around it, you'll find that most frail individuals are sarcopenic. But some sarcopenic individuals are also frail. So sarcopenia will not necessarily lead to frailty, but mostly frail people are sarcopenic. Most sarcopenic individuals are not cachectic also. But cachectic individuals are commonly frail. And most cachectic individuals are also sarcopenic. And then of course, not all frail individuals are cachectic. So if you see, cachexia will definitely lead to frailty and sarcopenia. And frailty will definitely lead to sarcopenia. So there, it's like I said, interrelated. That's why the three circles are overlapping each other. So we talk about sarcopenia. So sarcopenia is the age-associated loss of skeletal muscle and function. And there are many reasons for this. One major reason is physical inactivity. There's this saying which says, use it or lose it. So don't use your muscles, you don't walk and all that. Gradually, you find it difficult to do so. You don't climb your stairs. Gradually, so sarcopenia is the age. So physical inactivity. And then, of course, there are other factors like disease, hormonal status, inflammation, and nutritional deficiency. And then, of course, we know that free radical damage. So reductive oxygen species, when these get collected in the body, they introduce or induce oxidative damage. And this could lead to the loss of muscle fiber. And that ultimately leads to sarcopenia. And cachexia, we already talked about. And sarcopenia is a very highly prevalent condition. You may not, it's not, we are not yet so aware that we measure it as a disease. But yes, in elderly, it's a very common condition which leads to disability. And for this, adequate protein becomes very important. Because to maintain muscle mass, we need the adequate dietary protein. And for that, the elderly should have a slightly higher protein intake. So while your RDA is 0.8 grams per kg per day, for preventing sarcopenia in elderly, we would talk about something like 1.2 grams per kg per day, which I'm sure those of you who have elderly patients or elderly relatives at home, we will find it's not very easy to provide through a normal diet, because they are eating very, very little food. But we'll talk about that later. Okay, and then we have the anorexia of aging. Now, anorexia of aging becomes, again, a very important thing. Loss of appetite as they grow older. And this is more prevalent among frail individuals. And the anorexia, the reason is again multifactorial. So it could be medical, it could be environmental, they're living alone, they don't feel like cooking. It could be death of a spouse. It could be, arthritis, where they find it difficult to cook or they're difficult to procure food. So there are many, many reasons for this. And this is a contributor to both sarcopenia and frailty. So anorexia is also a powerful tool of measuring the quality of life in older people. And we have to identify those people who are at risk of anorexia and provide multi-stimulus interventions. We'll talk about that, how to increase their nutrient intake without increasing really the quantum of food that they take. and we need to arrest that weight loss which happens, because weight loss is contributing to functional decline. So there are many diseases associated with frailty. We've talked about some, but like I told you, obesity, because obesity is associated with chronic inflammation, diabetes, because diabetes is, even complications like neuropathy, hypotension, peripheral vascular disease, cognitive dysfunction. Pain is a major precipitant of failure. So what happens? Somebody who has arthritis has acute joint pain, and because of that, they limit their activity, and that leads to loss of muscle mass and decreased function. They have also seen that though there is no direct relationship of anemia with frailty, but people who have anemia have chances of increased syncope, that means becoming unconscious all of a sudden, disability, depression, cognitive dysfunction, mortality. And depression is associated with frailty because, again, there's weight loss, there's functional decline, and most people who have cognitive dysfunction become frail. And then, of course, osteoporosis and falls and fractures are very important precipitants of frailty. And, falls and fractures are a major issue in old age. And once an old person has, say, a hip fracture, chances of their quality of life deteriorating are very, very high. So when we look at malnutrition, we know that among the frail elderly, nearly 20 to 60% are malnourished. And what we must remember is that malnutrition in elderly cuts across classes. So it's not only the poor or the socioeconomically deprived elderly who will be malnourished, like in the case of children. But in elderly, even the well-to-do affluent would be malnourished and very high levels of malnutrition. So they have unintended weight loss. There is an imbalance with the amount of food that they're eating. There may be anorexia, like I told you, and there's also inadequate intake of protein. And the frail elderly generally have a lower intake of protein. And that leads to the loss of muscle mass and weight loss. And of course, not only nutrition, but even activity contributes. So if there's reduced physical activity, that would also implicate or, result in frailty. Now, when we look at weight loss, when there is a decline in the energy intake, there can be a dramatic decline in muscle mass and strength in elderly, leading to weight loss and disability. And this is a very famous study, old one, Vilas et al., and they showed that energy intakes below 25 kilocalories per kg per day in elderly women, chances of frailty or death were much higher. The odds ratio was 3.3. So they need a basic amount of energy, which is 25 kilocalories per kg per day. And while most frail people have reported some amount of weight loss, it could be due to all these reasons we've discussed about, even simple things like dehydration, cachexia, anorexia, sarcopenia. And like I said, depression is a very major factor. Besides that, side effects of medication and therapeutic diets are also, contributors to the weight loss. And as I mentioned earlier, weight loss can lead to hip fractures and increasing disability. So how much should the protein intake be? I just told you a high protein is recommended, about 1.2 grams per kg per day. And those who are already, this is for prevention, but those who are already frail would require 1.2 to 1.5 grams per day. Sorry, this is a misprint, not kgs per day. And that would help them improve their condition. There's a lot of talk going about branch chain amino acids like leucine contributing to protein anabolism. And but there are still studies need to be done to establish the long-term benefits. And leucine is found in whey protein. And you all know all the gym goers and sport people talk about whey proteins. But in elderly people, the whey protein is more easily digested, and it has a higher leucine content, and therefore it may be beneficial. There's creatine supplementation in addition with exercise, and that has also been found to have positive effects. But what was very interesting in all the studies that were done, it was not only the quantity of protein or the total quantity and quality of protein, but also the timing and the amount of protein ingestion. So they said that when one meal contained most of the protein intake, 80% of the day's protein intake was given, say, at dinner, that had a much more beneficial effect on lean body mass than dividing the total intake within 3 meals or 4 meals. So this is again very preliminary data, and this really needs to be explored further. And then, of course, we have vitamin D. There are few longitudinal studies on vitamin D status and frailty, but there are some systematic reviews which have shown that lower vitamin D status, there is a greater risk of frailty. And it's also been shown that people who have vitamin D deficient have poor muscle function. And on giving them vitamin D, the muscle function improves. But like I said, these studies are still ongoing. There are conflicting studies also, so we really need to establish this link much more strongly. Then we have the N6, N3 fatty acids, and the N3 fatty acids are beneficial. So you do know that our Indian diets are rich in N6 and poor in N3-PUFA. And this causes inflammation. And this is deleterious to the muscles. So fish oil, which is rich in omega-3, has a favorable effect, especially if we combine it with the proper kind of exercise, whether it is strength training and other aerobic exercises. Of course, for those who are not into fish oil supplementation, things like walnuts and all do have some amounts of N3-PUFA, which are beneficial. But we must remember that most of our diets are rich in N6, and therefore they are pro-inflammatory, and we need to take some active steps to balance it out. Okay, many other nutrients are there. Generally, frail elderly are likely to have multiple micronutrient deficiencies. So we have vitamin B12 deficiency, we have, deficiencies of vitamin C, vitamin E, selenium. These are, of course, antioxidants, and therefore they prevent the oxidative damage. Carotenoids are seen to be protective because there are studies to show that they prevent inflammation that leads to sarcopenia. And that is why there's a lot of talk about promoting fruits and vegetables among the elderly. And then, of course, we've just talked about the fish oils. Other dietary factors are milk and dairy. There is still not enough evidence to show the effects of milk and dairy foods on frailty, but some studies have shown a protective effect. Then we have ultra-processed foods and the gut microbiota. Today, we are all talking about the gut microbiota, and the gut microbiota is linked to inflammation in the body. And we do know that inflammation is important in the pathophysiology of frailty. So therefore, good gut health may protect against frailty. So all the talk that we have, I don't think I'm going to repeat everything here, but a lot of foods are good for the gut microbiome and some are not. So the ultra-processed foods with food additives and all are not healthy for the gut. And those should be avoided, but those which promote or are helpful, like prebiotics, probiotics, fiber, all these which promote a healthy gut could be beneficial also to prevent frailty. But like I said, this is all still work in progress. India again has a very rich repertoire of herbs and spices, rich in antioxidants, polyphenols, and therefore they may be protective. We don't have many studies. I mean, Ayurveda, of course, has a plethora and a very rich literature base on it. But in terms of our modern science, these are still being studied. And therefore, things like curcumin, we know it stimulates. I mean, all of us, I think in our childhood, have had haldi ka doodh whenever you have an injury because it's anti-inflammatory. And this is important. And of course, for cognitive frailty, a lot of people talk about Brahmi and Ashwagandha and all. But as I said, we still need some, robust scientific evidence, say from RCTs, to come on these. Poor appetite, I've already told you, is a risk factor for frailty because it leads to weight loss. And therefore, how can we improve appetite becomes a very important issue in old age. So it could be the mood, playing some music. It's seen that eating together, eating with other friends or family makes a difference. Physical activity, gut microbiome factors, even things like, adding flavor enhancers to the diet. Studies have shown that adding a little Ajinomoto to the diet definitely, I mean, monosodium glutamate to the diet definitely increases food intake. And you'll be surprised, many elderly are very fond of our, ultra processed foods, which have a lot of masala. So whether it's chips or noodles or whatever, it's the masala, the enhanced flavor, which is giving them that desire to eat them. So they may not have an appetite for normal food, but they would immediately love to have, say, noodles or something else. So we really need to explore these as positive contributors to increasing appetite in the elderly. And then there's a lot of literature which says that the Mediterranean diet is beneficial and for overall health and also for preventing frailty. And you can see it has many of the components that we have talked about. So plenty of fruits and vegetables, olive oil, fish, which is N3 rich, and nuts, again, fruits and nuts. And it has spices, it has garlic. All these are factors which are healthy, which are anti-inflammatory, rich in antioxidants and polyphenols. And therefore, it's found that people who are having the Mediterranean diet have a positive effect on mobility and a lower risk of developing disability. Other diseases, like I told you, depression is an independent correlation of frailty. Poor oral health is another big issue, not having dentures, not having, having faulty teeth, having decayed teeth, not being able to chew food, especially in those who are living in institutions or long-term care, but even at home. Poor oral health is a very big contributor to poor malnutrition, in old age. And as I told you, individual and neighborhood socioeconomic factors. So, even having common places to eat, a common dining room in a building complex where maybe all the elderly can get together and have a meal together, have a cafeteria, something like that, something to interact together. Because, meeting people, talking, social interaction is very important to also prevent from depression, loneliness, and other such factors. So, it's not only nutrition and physical activity, but a lot of other policies that we would have to look at when we are looking at targeting frailty in the elder people. So how can we prevent or delay frailty? We have to prevent or delay functional decline. We have to maintain functional independence. We have to minimize weight loss and minimize loss of muscle, reduce the falls risk. And for that, we need exercise, we need nutrition maintenance. Obviously, as I said, the appetite is poor, the diet is poor. They may need supplements. We need to look at issues like oral health, the socioeconomic environment they're living in, the family and all that. And we also need to be socioculturally informed when we are doing their assessment. So it can't be only medical diagnosis. It has to be an entire diagnosis. There are no definite models which have come up in India, at least. Abroad, there are some which are there. And the interventions are basically based on nutrition and exercise for management of frailty. So when we look at nutrition, it just says maintain an active lifestyle with a diet which provides a rich supply of fruit and vegetables and frequent oily fish. So this, would cover nearly most of the components we're talking about. Very important is the gut microbiome. So how do we make the gut microbiome healthy is an entire seminar on its own. So I won't delve into all the things here, but definitely dietary changes, inclusion of factors like prebiotics, probiotics, Today, people are even talking about microfecal transplants. So these could be an interesting area to prevent frailty or even treat acute frailty in older people. Using exercise becomes very, very important, and not only aerobic exercise, but we need to also do progressive training of strength and function. So strength training is very, very important. And the recommendations which are given for 60 years and older is at least 30 minutes of aerobic exercise on all days. So whether it's walking, swimming, cycling, and strength training 2 to 3 days a week with a day of rest between workouts. So if a person is going to a gym, it's one set of 8 to 12 repetitions on 12 or more machines. Doing it at home, 2 to 3 sets of 8 to 12 repetitions using 6 to 8 different exercises. And when 12 repetitions can be made in good form, then weightlifting should be increased. So as they become more and more proficient in it, the weights can also be increased. And when you look at nutrition, important thing is adequate calorie and protein intake. So like I told you, 25 kilocalories per kg body weight, at least 1.2 grams of protein per kg body weight per day. And this effect is better when it's coupled with exercise. And besides that, if it is difficult for the person to consume this amount of energy or protein through the diet, then maybe we need to look at a supplement, oral supplement in proteins, of a protein calorie supplement. And of course, vitamin D is a minimum replacement dose at 1000 IU per day, and fish oils are beneficial. If the person is very elderly and frail, or if the person is unable to eat sufficient quantity of food, tube feeding may also be recommended. But this is in cases where oral intake becomes difficult to meet the requirements. Enhancing the appeal of food and thereby increasing food intake. This is very, very important. So like I said, flavor enhancers, simulated food flavors. That's why all your processed food is very tasty for the elderly, because they are simulated food flavors. And then, even things like orexogenic agents, which increase appetite. So appetite stimulants. And then fish oils, because they are anti-inflammatory. And we've already said about gut health. So when a person has been identified as frail, you need to have multimodal interventions. One intervention will not work. So whether it is a protein calorie supplement, whether it's a micronutrient supplement, whether it's improving gut health, vitamin D, fish oil, exercise, strength training, all these have to really go in hand. And maybe even counseling, company, having somebody to talk to, all these will help. Thank you so much. Okay, Shreya.
Thank you so much, Dr. Seema Puri, madam, for wonderful eye-opening session, I must say. You explained very nicely how frailty is related to many diseases, including metabolic and chronic diseases, obesity, malnutrition, as well as how good nutrition can improve frailty and improve quality of life, as well as good hygiene, physical and social activity, some micronutrients, if we can, tackle beautifully gut microbiome, that will help and delay, aging related frailty. And sometimes I have seen sarcopenia, not, post 60s. Nowadays, I have seen many, especially as you told, that women are majorly, suffering with frailty and sarcopenia. It is very common nowadays. So thank you so much, Dr. Seema ma'am, for wonderful session. Thank you. You are muted, ma'am.
I said thank you so much, Vinita. Thank you. That's my pleasure.
Over to you, Shreya.
Thank you, ma'am. Thank you so much, Seema ma'am. That was a wonderful presentation. Let us now delve into the Good Monk Hero products. that is Family Nutrition Mix and Good Monk Healthy 50 Plus Nutrition Mix. Let me introduce our panel of nutrition experts and scientists who constantly guide us with their expertise and immense knowledge in nutrition and product development. Dr. B. Shashikaran, Dr. P.R. Krishnaswamy, Mrs. Mallika Janki Raman, Dr. Neerja Hajela, Mrs. Sheila Krishnaswamy, and Dr. Shovan Ganguly, who are part of our scientific council. Now, talking of the Good Monk products, Good Monk Healthy 50 Plus is a combination of 15 essential vitamins and minerals, clinically proven probiotics, prebiotic fiber, and ashwagandha and brahmi. And when this nutrition mix is added to food, it doesn't change the color, smell, or taste of the food. So as ma'am was emphasizing on the micronutrient intake, especially vitamin D and B12, so it is designed such that it contains those vitamins and minerals. It is made up of vitamin A, B complex, vitamin C, vitamin D, E, K, along with minerals like iron, zinc, selenium, and chromium. It also has lysine, which is an amino acid lacking in cereals. The recommended dosage of Good Monk Healthy 50 Plus is 2 sachets per day, which provide 60% of RDA of most of the vitamins and minerals that it contains. Good Monk Healthy 50 Plus, as mentioned, contains selenium, antioxidants, iron, and zinc that help support immunity. It also contains 130 crore CFU of clinically proven probiotic Bacillus coagulans and a prebiotic fiber fructooligosaccharides, which builds a healthy microflora in gut. Healthy 50 Plus also helps improve energy levels and mental function. Moreover, it supports bone health as it contains vitamin D and K. Apart from its unique combination, it is also very easy to use. Unlike multivitamin tablets, syrups, capsules, and gummies, it has no taste, smell, and odor, and it can be easily mixed into any food. This is Good Monk Family Nutrition Mix, which is similar to Healthy 50 Plus in its composition, which includes essential vitamins and minerals, probiotics, fiber, lysine, ashwagandha, and brahmi. Healthy 50 Plus has more of antioxidants and certain micronutrients to support nutrition in old age, whereas this is for children and adults of age 4 to 50 years old. 1 sachet is recommended for age 4 to 12 years and 2 sachets for 13 years and above. 1 sachet will provide you with 20 to 30% of RD of vitamins and minerals to children, whereas 2 sachets a day will provide 45 to 60% RDA to adults. It contains no added sugar, no preservatives, no fat, and only 5 calories per sachet. We are proud to say that Good Monk Family Nutrition Mix is a clinically proven nutrition supplement. It is clinically proven to improve gut health, energy, and immunity. It was shown in a clinical survey which was conducted among 72 participants for 120 days by an external clinical research organization. Sharing some of the highlights from the clinical study, it was observed that 92% improvement in gut health happened in 120 days. You can also see the month-on-month improvement in constipation, bloating, acid reflux in the graph on the right. Gut health was also assessed using the Bristol stool chart, wherein 93% improvement in gut health was observed. As shown in the table in right, type 3 and type 4 are normal stool pattern or textures. And it can be noticed from the graph that at the baseline, only 29% of the participants reported a normal stool texture with a type 3 and type 4 category, which was increased to 51%, 61, and then 93 at the day 30, 60, and 120 respectively. That was about gut health. Let us now focus on immunity. 91.5% improvement in immunity was observed in the participants. As shown in graph, it improved from 33% at day 30 to 65% at day 60 to 91.5% at day 120. When it comes to energy, 83% improvement was observed in energy levels at day 120. As evident from clinical trials, it not only improved gut health, energy, and immunity, but also improved levels of vitamin B12, D, and iron, which was based on the biochemical tests. thank you so much for listening. We would like to now open the Q&A session. We shall take up your queries from the chat box. So request all the participants to please put their queries in the chat box. Yeah. So we have one question from Shomam, which is, can you please highlight, Seema ma'am, can you please highlight on the sarcopenic obesity observed in elderly individuals?
Yeah, in fact, this is what we are talking about. We are talking about loss of muscle mass. And, in many, there is accumulation of body fat because there's less physical activity. So the muscle mass becomes weak because of disuse and not using it. And therefore, all the strategies that I've talked about would also help to combat sarcopenic obesity. So it's physical activity plus diet, and mainly strength training becomes very important here because we want to retain muscle mass and burn the fat. And all the other factors, what we've talked about are, sarcopenic obesity would really be a classic case which leads to frailty in elderly.
Thank you, ma'am. I think we don't have any more questions.
Are you sure it's a different group? So maybe or the
No,
chat
ma'am.
box is
Yeah,
common.
yeah, we are able to access that.
But one thing I must say, Seema ma'am, I have heard first time that Ajinomoto helps in, it increases appetite somehow. So can we, suggest or recommend some kind of little amount of, Ajinomoto to use if a person is
Yes,
having,
so let's not take the trade name and we call it monosodium glutamate.
yeah, MSG.
My mistake to call it Ajinomoto, but yes, it's a flavor enhancer,
Oh.
and that is why if you even have, like at home, if you have yesterday's cooked food and you have guests coming over, just sprinkle a little Ajinomoto on it. It starts, flavorful again. Those khushbu and the aroma and all comes back. So it's a flavor enhancer. And what happens in old age is that the taste buds atrophy, na? So they are not able to sense, and also smell gets affected.
Yes.
So they're
Yes.
not able to smell, say, coffee or basmati rice, and therefore the appetite is affected. And
Yes,
similarly,
yes.
the taste.
Hmm.
So they like enhanced taste, and you'll find that the elderly love, all your namkeens.
See,
All the packet
yes, very
namkeens,
true.
all the chaat pakodi, everything which is highly flavorful. Even like I said, instant noodles,
Hmm.
they love it, and because of the enhanced taste. So if normal food they're not able to eat, if you just add a little bit of flavor enhancer, it could be, one is Ajinomoto, but even things like, garlic and ginger and, some chaat masala, some garam masala, this would also help to enhance the taste.
Yes, yes. Thank you.
But there's
Thank you
no
so much.
harm. Let me also tell you, FSSAI regulation says that a little bit of Ajinomoto is not harmful. I mean, the levels which cause harm are very, very high. And I always say, look at the evidence. The Chinese have been having it for 100 years. There's nothing wrong
True.
with them.
True.
Chinese, Japanese have been having it for donkey's years, and there is no health,
Related
phenomena
issues.
reported with adverse effects reported with it. So if we are putting it occasionally, there's no harm.
True. True. Very well said, ma'am. Thank you. Thank you, ma'am.
Okay. So as we conclude our today's webinar, I want to extend a sincere thank you to all our participants for joining us and engaging with the discussion. Your questions made this session meaningful. I also want to express our gratitude to our esteemed panelists Thank you, Seema ma'am, for such insightful and exhaustive presentation. We have covered a lot of ground today. And thank you, Sheila ma'am, for joining in. Thank you, Vinitha ma'am and IDA MP chapter. Thank you, Amar sir. And thank you once again to everyone involved for making this webinar a success. Have a great evening, everybody. Thank you.
Thank you, Seema ma'am. Thank you, Sheila ma'am, for joining us today.
Thank you. Thanks to both of
Thank you, Shreya and Mr. Anand. Thank you.
Yeah, thanks, Amar.
Thank you.
Thank you, ma'am.
Thank you.
Bye.